friends, welcome to my channel. This is the first video on my new channel, and for the first video I thought what better way to start this whole thing out than by talking about something I am very passionate about and is extremely personal to me, and that would be CHD, congenital heart disease. Many of you may know if you know me personally. If you don't, then I have congenital heart defects. I was born with quite a few. I was born with pulmonary atresia, with ventricular septal defect, and multiple aortopulmonary collateral arteries. It's a mouthful, I know, but that's me. CHD is the #1 birth defect. 1 in 100 babies are born with it. And so it's pretty common. I'm sure you may not know it, but you probably know somebody with CHD. So today, what I wanted to do is talk a little bit about CHD. I did a little question thing on my Instagram as well as my Facebook, seeing what you guys wanted to know, whether you're parents with kids with CHD, your fellow patients, your friends, family of people with CHD, whoever. I wanted to see what you guys wanted to know and potentially what you wanted to just discuss. And I got some really good feedback, so much in fact that I think I'm going to do 2 videos. So what I want to do today, the first one, is stuff from a patient perspective. So these are things that we as patients either get told, comments we get, or questions fellow patients might have had for me or people had for me as a patient. First, I would like to say everything I'm about to talk about, these are my own personal experiences. This is how I feel about it. So please don't take that as anything other than that. I'm not trying to say this is how every CHDer feels. This is just my own personal feelings and reactions to it. Also, I am not a medical professional, so none of this is to be taken as medical advice. If you have any questions, please consult your cardiologist. If you're an adult patient, please make sure you do see an adult CHD cardiologist at least once in your life, but depending on your condition, it is good to have yearly follow-ups, again, based on what they recommend. So that's just my little spiel. All right, so let's get started. Okay, oh, by the way, I don't know if I said my name. My name is Jenny. It's nice to meet you. Thank you for coming here. Also, I only have 20 minutes to film this video, so I'm going to try and go and get it all done in that. I'm sorry if I talk too fast. I do normally anyway. So let's get into it. The very first comment, I know I have gotten this many times, I know other patients have too, is "you don't look sick." Well, thank you. I appreciate that. I mean, many times it's because I'm wearing makeup, but I don't always. And usually the days I don't wear makeup are the days that people are like, "Oh, are you okay?" It's like, this is just who I am. I'm so sorry. But yeah, a lot of times because we look like everyone else, they don't know that there's something else going on in there. And I'm sure anybody with an invisible illness can identify with that. It's invisible. So you don't always know stuff's happening. You could be in heart failure and no one knows it. And that can be extremely frustrating as a patient because they don't always take you seriously when you say you need to rest, or you know, something that they maybe want to do as an activity isn't always something that you can do, and people sometimes don't always understand that, and that can be incredibly frustrating. So yeah, I get you. That is something I get more than I like. Second, oh my lord. Okay. Oh, so you're fixed. You're better now. You've had heart surgery, so it's all good now, right? No, that's not how it works with congenital heart defects. You know, we've had a surgery. It's usually to help potentially correct it, but it doesn't mean it goes away. And depending on your defect, that may be a surgery you have to have multiple times. I know for me, with my particular one, my valve only lasts so long because it is a tissue valve. And so it does need to be replaced every so often. So no, just because I had a surgery doesn't make me, I can run a marathon now. Again, my particular situation, some heart patients have, and that's amazing for them. But yeah, surgery is not a fix. It is usually just something to help palliate the situation to give you more life. Yeah. What's it like to have had heart surgery? Okay, that's weird. Or not weird, but there was a girl in one of my CHD groups. She actually posted this on her commentables. Well, what's it like to not have had heart surgery? You know, it's what we've known. If you are someone who's, had hip surgery, well, what's it like to have had hip surgery? You're like, well, I don't know, what's it like to have not had it? It's just part of our life. Not all CHDers have had surgery. I'll make that open because of their particular defect or what their care team has decided to work for them. So, and just because you haven't had surgery as a CHDer doesn't make you any less of a CHDer. I want to say that too, because I have met people and they feel like, well, I don't have the scar, so what? That's absolutely fine. You're still one of us. But yeah, just, I don't know. I had heart surgery. I've had plenty, actually. I'm 34, and at least the ones that I know about, I've had about 11. I think 5 or so have been open heart. I've had a lot of catheterizations. I've also had a defibrillator surgery, which is technically not open heart, but I have a big scar from that. I've had scars from where they did my BT shunts. It's a little medical jargon. I'm so sorry for those of you who don't know. But you do know BT shunts. I've had one on each side. I also had a central shunt, so I have scars on my back from that as well from when I was a baby. So it's just part of my life. It's what I know. I don't know. This is a funny story, and I hope I don't run out of time, but I'm going to say it. So I remember when I was younger, I was preparing to have, I think it was a catheterization they were going to be doing to check on my valve before they were pretty certain it was going to need replacing. And so I was having a catheterization, and I remember being in the prep room. They were, getting the IV going, and they were like, "You ready for this?" I'm like, "Yeah, fine." And like, I could see my parents right there, just kind of freaking out. I think I was at like 11 at the time, so we've been through quite a few, but still, I'm sure as a parent, no matter what age your kid is, they're still having surgery, and that's scary. And so I remember just being like, yeah, let's do this. It was no big deal to me because I'd been through so many that like I wasn't really freaking out, though I think now as an adult, now I remember a lot of them, so I probably would freak out. But at that age, most of them had been when I was an infant, so I didn't remember much. I was like, oh, it's the hospital, whatever, it's like home, let's do this. So yeah, it's just a part of our everyday thing. I mean, not every day, it's a part of our life. This one, oh, but you're so young. I've gotten this more than I like to have had. I've gone to so many like other doctors for other conditions, and then they see my cardiac history and they're like, oh my gosh, you're so young. And I'm like, well, when it's something you're born with, it happens pretty young. So I think that's also maybe a lack of education. People don't always know what congenital heart disease is. Congenital, by the way, means from birth. So if somebody has any sort of congenital defect, it means they were born with it. So yeah, for me, again, this is just part of my normal life. And so when people are like, oh, you're so young, it's like, well, I'm so young, but I feel like I've been through a lot. And CHD, I think also people get very confused with acquired heart disease, stuff like stroke or things like coronary artery disease. So this is not the same as, maybe I ate way too many hamburgers and now I have buildup in my arteries or whatever. It is, it was actual defects, things that were not formed correctly with my heart. So it is very different, and that's why, we are young, because we were born with it, and we've had a lot to go through as kids, teens, and adults. So, yeah, 34, and I got heart disease. Oh, this is a really good one. One of my friends posted this on my Facebook, and I thought it was extremely pertinent to, I would say, any CHDer. And I know I'm kind of experiencing that even more right now. And it is, people expect us to be normal. And I'm just going to say, normal is not my favorite word. I really dislike it, especially when you're talking the spectrum of health conditions, because honestly, what is normal? I just don't like it, because I think normal automatically means you're comparing yourself to something else. And I don't know, I really try not to do that. I don't like the feeling of, oh, I'm not normal. It's like, well, okay, well, I don't know, as a kid hearing that is one of the worst things, at least for me. Like, that will put a negative place in your head, like, well, what's wrong with me if I'm not normal then? So, normal is a word I don't necessarily love to use, but I know that people do it, so that's why I'm going to potentially be saying it in these videos. So, people expect us to be normal. We don't always have the energy to do that. So how do we be a real adult? And I think this is something we all struggle with. You know, I do definitely, because of energy issues, or just my physical capabilities are not the best. I can't run, you know. There's just some things I can't do. And that's okay. That's for me, you know. And I will say it can be really hard when people, you know, again, because our illness is invisible, our defect is, you know, invisible. People don't always know that you may need extra time, or it's really hard with friends to sometimes keep up with things. And I've had issues with that in the past, but I've got a good group of people around me that are very understanding of that. So, and I know, especially as far as working and jobs, you know, I had to lower some of my hours this past year because I've been struggling with it. And even now, I'm struggling with what I'm doing, and I'm only working like 24 hours. Granted, I do have a fairly physical job, but still, it is very hard as someone who's 34 and working basically part-time to see friends who are working like 60 hours and like doing all these things. And I'm just like, oh my gosh, you know, it kind of makes you feel like less of a person. You're like, what am I doing wrong? But then I have to realize my situation is very different from theirs. And it's taken me a long time to really come to terms with it, but I realize you cannot compare yourselves to others. You know, even fellow CHDers, even people with the exact same defect, it is so unhealthy to compare yourselves to them, because every person's situation is completely different, and everybody's abilities are going to be completely different. And so to try and compare yourself to someone else, it's never going to do you any good. And so I think, you know, you just do you. If that means you do work part-time, or if it means you need to go on disability, that's fine. There's absolutely nothing wrong with it, and it doesn't make you less of a person, less of an adult. I think you have to do what's best for you, that brings you joy, and that really helps your quality of life. And anyone who's going to make you feel bad about that is not someone you should have in your life. That's what I personally feel. I don't want anybody around me that's just going to bring me down and make me feel bad because I can't do something. It's like, I'm sorry, I can't change this. This is literally my limits, and I'm giving you my all. If that's not enough, then take care. So, yeah, everyone's different. I think you just have to do what's best for you and respect your limits and know that that's okay. It doesn't make you less of a person. It makes you a person that understands what you need for your body, and that you're respecting that, and that is freaking amazing, because it takes a strong, healthy person to know, here's what I can do and here's what I'm going to do. I'm not going to push myself just because you want me to. I think it's very strong for someone to do that. Okay, last question, and I had someone ask this to me. Any of this is my personal experience and what's worked for me, and they asked about going vegan. They were like, did your cardiologist understand or respect your decision to go vegan? and how has it affect your heart health? Has it been beneficial? And I'll say for me, it has. Again, everybody is different. So just because it worked for me doesn't always mean it's going to work for you. So this is not my advice. This is just my particular situation and my experiences. But I decided to go vegan in 2016. I, even after having a new heart valve and everything, I was still struggling a lot with energy levels and my health, and I had insanely high cholesterol to the point where they were like, we're probably going to need to put you on some cholesterol meds if this doesn't go down. And that kind of scared me because I've been on so many meds throughout my life and I just didn't want another one. And I know my family also has a history of high cholesterol. So I was like, well, this is inevitable. But, I had heard potentially going vegan could help. So I was like, well, for me, let's try this. Let's just see if it works. If it doesn't, then I'm open to talking about meds. So in 2016, I did go vegan, and I would say within the first 6 months, major changes for me. I lost about 25 pounds. My cholesterol total went from like 232, I think, to like 170 something. So huge difference. And I went to my cardiologist not long after that, and he was extremely impressed. He, was like, well, whatever you're doing, it's working, because your, blood work numbers look really good. You've lost weight, which is anything that's less stress on your heart. That's great. So they've been very supportive. And I appreciate that, and I'm glad it's worked for me. But again, I know everyone's different. Everyone, there may be other conditions you have to consider, and so you have to do what's going to work for your body. But yeah, it worked for me, and I'm grateful for that. I've literally stayed the same weight since then. I don't know how. I mean, I try to be healthy, but I'm not the healthiest person. But it has opened me up to trying new foods and new things, which have been good, and more heart healthy things, which I'm grateful for. So I think it's been great. Okay, so that was the last question. As I mentioned in the beginning, I am going to do a second video. The second one's going to be more questions from parents of CHD kids or teenagers, as well as maybe directed towards parents when it comes to like transition, health insurance, pregnancy decisions, all that kind of stuff. Because I got a lot of really great questions, so I knew I couldn't do this all in one video without this being a monstrosity of a long video. So, yeah, please stay tuned to that. Also, I know you're all new to my channel because it's my first video, but I would love if you would subscribe to this channel. I am going to be trying to do more maybe health-related stuff, whether it's CHD, fibromyalgia, because I do also have fibromyalgia, arthritis, maybe some yoga stuff, makeup, because I do love makeup. It's a fun thing for me to play around with, clothing hauls, house stuff, decorating, pretty much anything I might be interested in. I might do some recipe stuff, cooking with me kind of stuff. So we'll see. I'm pretty open-ended to if you have any suggestions of things that you would like to see, comment down below. Also, if there are any questions that you have or comments that you have as a patient that I didn't answer, comment those. I would love to potentially address those as well. Maybe either by replying back to you down there, or if there's enough, I'll do a second video in addition to the other one. If you're a parent, please comment down below. Let me know if there's any questions you have that I can address. And yes, thank you guys so much for joining me here, sticking through this. I really appreciate it, and I hope you have a wonderful day. I'll see you next time.